considering a proposal that would expand a list of minor ailments
I'm about to go home and
treatment for. The change would expand.
I'm going to be on TV, I think.
Pharmacists can now assess and treat without a doctor. It's supposed to take some of the burden away from the healthcare system, but as Greg Ross explains, the proposal is getting pushback from some in the medical community.
That's me.
Last year, Alexander Mahan started accepting customers at his downtown pharmacy, and they came in with minor ailments. And from the government began allowing pharmacists to prescribe medications
Watching this live.
pink eye and urinary tract infections.
It allows us to provide care that's immediate when the patient comes in and they have a minor condition.
In all, there are currently 19 minor conditions that pharmacists in Ontario can recommend prescription drugs for without the consent of a doctor. The province has a list of 14 more they would like to add, including sore throat, shingles, and lice. Mihaela says this benefits patients and the healthcare system.
He then just time instead of coming in with a problem like that we typically know we have a cold sore. Are we going to go burden the healthcare system by waiting in the emergency room? Or are we going to wait for an appointment for the doctor from the doctor that's going to take 5 days, a week?
Not everyone in the medical field sees it that way.
A lot of these issues that people come in with, and their symptoms are not just about the medication. They're not just about the prescription. Right? They're about, is this actually serious or not?
Dr. Dominic Novak is the president of the Ontario Medical Association. He says pharmacists don't have the training to diagnose patient symptoms.
Pharmacists are doctors. Doctors go to school for years, from thousands of hours to be able to diagnose and treat. Pharmacy training is
You don't want to be doctor.
Novak says that nearly 1 in 4 people in the province don't have a family doctor. He says the Ontario government would be better suited to address that issue.
if people with a family doctor end up using the emergency department less often, in hospital less often, they end up costing the healthcare system less money, making it more sustainable in the long run.
In a statement to the Canadian Press, a spokesperson for the Minister of Health said they have seen success in the program with over 1 million people getting treatment for minor ailments. Greg Ross, CBC News, Toronto.
To Brampton, where officials say
There you go, folks. This is the live report that was run today on the CDC right now. And I agree with Dr. Novak. We're not doctors. We don't want to be doctors. All we do is we assess based on the information that's provided, and we triage according to the symptoms that are presented. Right now, because of these minor ailments, our toolbox is just a larger, set, meaning that instead of just being able to recommend for allergies or Reactin 10 milligrams, I can do a larger dose. I can recommend a steroid nasal spray, eye drops that'll actually make a difference, and not have these patients go to the doctor when, in many instances, and that's where we step in, these patients already know what they have in terms of symptoms. And we can talk about the same thing with regards to hemorrhoids and the cold sores I was mentioning on the newscast, where, they're cold sores. You've had them for years. You can't wait to go to the emergency room. And why would you for a cold sore when 70 to 80% of the population have this particular virus? So that's what we're talking about, minor ailment. They are minor. We're not looking at serious problems, but as pharmacists, we are the go-to health professional. We are in the field. We're very accessible. And this is why patients come to us. So we're used to assessing and triaging and telling them, no, this is something that is minor and we can handle. Minor that we cannot handle, meaning that it is more serious, or you have to go to the hospital, and don't wait around for your family doctor to call you back. And I'm sure family doctors would love to get more involved and have more time with their patients, but there's not enough to go around. Unfortunately, there's not enough doctors. It costs money. Seeing a doctor for a cold sore costs a lot more money to the healthcare system than getting an assessment done and a product recommended for cold sore from a pharmacist. We can get into the details of how much it costs. It's $15 for a virtual consultation or $19 for a walk-in consultation, which is a lot less than a consultation diagnosis done by a doctor, right? So worst case scenario, and I tell my patients that, okay, let's say you have a cold sore and it's not a cold sore. Well, I give you some, antiviral called valacyclovir. You're going to use that for 1 day, right? By day 2 or 3, see no improvement, then you go to the doctor. At least we know that we've tried this. And sometimes it's not obvious, but those medications that were recommended to you, the Valtrex, hardly any side effects, super innocuous. It will be no problem taking it and saying, okay, well, doctor, I've tried the valacyclovir, it didn't work. Okay, now they know, right? And our obligation as a pharmacist is that once we've, don't want to use the word prescribing because I think it ruffles a lot of feathers when I say prescribing. Well, when I'm recommending this medication, yes, it happens to be under the traditional umbrella of prescription, but now we're allowed to recommend it, write it, assess for it. For cold sores, of course, recommending and writing, the medication, valacyclovir. So at that point, we've written it, we've recommended it, and it didn't work. Okay, well, we move on to the next step, and we inform the doctor if they have a family doctor that we've recommended this product, and they've taken it and they've used it and it didn't work. And many times we have nobody to inform. Right, so these patients are bounced around walking clinics to walking clinics or emergency rooms. Right, so we take the example of the valacyclovir for cold sores, but hemorrhoids. Right, we're taking it minor ailments. If there is an issue with hemorrhoids, we recommend over-the-counter products, or now we can also recommend a product that normally is under the prescribing umbrella of the physician, but we can do that as pharmacists. Same thing for a UTI. We're not taking on new UTIs. I'm not there to diagnose new UTIs, right? 16-year-olds, first time ever getting the system, males. We don't take on those patients, right? We're taking on the woman that has, knows her body and knows that she knows that she has the symptoms of UTI. So we're going to recommend it, prescribe it, and if it didn't work, then at least we know now that she didn't wait 5 days to see a physician, didn't wait at the emergency room, it didn't work. At least now we know it is more serious. Time to do something. And we can talk about at length, all of these minor ailments that we're going to be doing, that we're doing right now, 19 of them, and then we're increasing them to by 14 more. We'll be able to assess for strep throat with testing. We'll be able to do, the list like minor headaches, minor migraines. There's a list there that I don't have in my head right now because it's still being reviewed. But those are things that we assess for on a regular basis. Right now, yes, we're doing rhinitis, and I have here the poster that I keep outside the store. We're talking about hemorrhoids, UTI, pink eye, cold sores, sprains. We're talking about painful periods, acid reflux. We're talking about rhinitis or seasonal allergies, dermatitis, insect bites. We also do now acne. We do vaginal candidiasis. We're doing thrush. We're doing nausea and pregnancy. So those are the things, again, that we assess for. Minor ailments, we have that conversation that we have on a regular basis with our patients, but now our toolbox is larger. We're able to do something more useful for patients and save money to the healthcare system, but more importantly is saving patients time, when time and many times is an essence for a lot of these assessments. So I hope this information is helpful. My name is Alex. Please, if you have any questions, just reach out. It's I run a pharmacy at the corner of Sherbourne and Richmond, but mainly it's MisterPharmacist.com, your Toronto online pharmacy. All right, stay healthy, everyone.